Dear participants, I will make my presentation. It's a part of a project called Clinical Care for Electrical Stimulation in Physiotherapy and Rehabilitation. Our project is co-founded by Erasmus Plus program of the European Union, and our project is led by Pamukkale University, Nilüfer Çeşitli Korkmaz, and other partners, University of Craiova, Hatay Mustafa Kemal, Başkent, Süleyman Demirel, Şule State, Burdur Mehmet Akif Ersoy Universities, and other associated partners, Turkish Physiotherapy Association, Romania, Lithuania, and Estonia associations are our other associated partners. My presentation is about electrical stimulation for the brain-innervated muscles with the presence of atrophy. Uh, We write this chapter with Ceyhun Türkmen from Çankırı Karatekin University and me, Esra Doğru Özmeli from Hatay Mustafa Kemal University. Electrical stimulation is a frequent and effective therapy for innervated atrophic muscles. This approach employs electrical stimulation to activate and strengthen muscles to restore and improve the quality of life. The application of electrical stimulation methods can be beneficial for spinal cord injury, peripheral nerve injury, and other neuromuscular illness. Treatment with electrical stimulation are necessary to re-innervate atrophied muscles and restore them. It is essential for muscles that have undergone denervation and reinnervation to be stimulated, encouraged to develop, and strengthened by the application of these methods by electrical stimulation. The importance of electrical stimulation in reinnervated atrophic muscles can be attributed to their ability to improve patients' quality of life and overall function. Electrical stimulation therapies can aid in resolving these impairments by promoting muscle development and function, boosting general strength, and enhancing the patient's ability to the daily course. Physiotherapists, occupational therapists, and other rehabilitation specialists routinely use electrical stimulation treatments to treat patients with neuromuscular problems, including reinnervated atrophic muscles. Anatomy and physiology of reinnervated muscles. After a period of the denervation, nerve fibers repair and reconnect muscle fibers in a process known as reinnervation. The process of reinnervation, which necessitates a complex interaction between the neurological and muscular system, is critical for restoring muscle strength and function. Muscle atrophy is the wasting or loss of muscle tissue as a result of several conditions such as inactivity, immobility, aging, and neurological illnesses. When muscle fibers are not sufficiently activated, muscular atrophy can occur, resulting in a decline in muscle size, strength, and function. Anatomy of reinnervation. Due to lack of nerve stimulation because of damaged or severed motor neurons, muscle fibers are denervated and this process may cause atrophy. The neuron might be able to regrow its axons and reattach to the muscle fibers if the damage is limited to that area. The reinnervation involves several stages, three stages. One of them, the first one, axonal sprouting. To reattach muscle fibers, the injured motor neurons axons starts to grow new branches. And the second stage is target recognition. To link with the right muscle fibers, the sprouting axons, look for and identify them. And the last one, the last stage is synapse formation to transmit nerve impulses and cause muscle contractions. The axon terminals create new synapses with the muscle fibers. And physiology of reinnervation. Neurological and muscle systems interact intricately during the reinnervation process. The following things occurs after the axon have grown and reconnected with the muscle fibers. In retrograde signaling, the rejoined axon communicates with the cell body via retrograde signals, which activate the gene expression and protein synthesis required for nerve fibers upkeep and expansion. In remodeling of muscle fibers, the rejoined muscle fibers alter in size, shape, and contractile characteristics to accommodate the new nerve supply. Motor unit requirement, the re-energized muscle fibers are absorbed into the already existing motor units, resulting in an improvement in strength and functionality. The anatomy of muscle atrophy. Muscle atrophy can occur due to numerous factors, including disuse, immobilization, aging, and neurological disorders. Some of the anatomical alterations that result from muscle atrophy include the following. A loss in muscle mass is caused by a reduction in the size of the muscle fibers, which become smaller in diameter. Myofibril loss is another factor that affects the muscle size and strength. Myofibrils are the contractile units of the muscle fibers. Alternations in fiber type 2 fast twitch fibers, which are more prone to atrophy, may replace type 1 slow twitch fibers in muscle tissue. The physiology of muscle atrophy. Muscle atrophy is caused by several complicated and poorly understood physiological processes, including protein deterioration. There is an increase in the breakdown of muscle proteins, which results in a loss of muscle mass. Decreased protein synthesis. This results in a reduction in the production of new muscle proteins, which accelerates the loss of muscle mass. Mitochondrial dysfunction, the energy producing mitochondria starts to malfunction, which contributes to the loss of muscle function. Overview of electrical stimulation for reinnervation. Electrical stimulation is a type of therapy that strengthens and improves the function of the muscles by stimulating nerves and muscles. Some electrical stimulation techniques can be applied when reinnervated muscles exhibit atrophy. Electrical stimulation can lead to regeneration of all motor axons within 3 weeks, rather than the typical 8 to 10 weeks that it takes out without stimulation. We know that electrical stimulation increases the speed of regeneration. Instead of 10 weeks, it decreases the duration to 3 weeks. This finding is significant because it suggests that electrical stimulation may be a useful technique for promoting nerve regeneration and accelerating the recovery of motor and sensory function following nerve injury. By accelerating axon growth and promoting neural regeneration, electrical stimulation could potentially lead to faster and more complete recovery from nerve injuries in humans as well. Transcutaneous electrical nerve stimulation is one of the most used techniques in physical therapy. And tense transcutaneous electrical nerve stimulation is most used for reducing the pain and encourage muscular activity. We use TENS for pain reduction. Reinnervated atrophic muscles with nerve loss or muscle atrophy may experience pain relief from TENS. The TENS unit's electrical impulses can prevent pain signals from reaching the brain, thus lessening the perception of pain. Another effect of TENS is muscular activation. Reinnervated atrophic muscles can also benefit from TENS to stimulate muscular activation. Muscle contractions brought on by the TENS units, electrical impulses, might enhance muscle function and strength. And TENS also provide muscular growth. TENS can be applied to reinnervated atrophic muscles to encourage muscular growth. The TENS units electrical impulses can encourage the creation of growth factors, which can aid in promoting muscle growth and repair. The recommended parameters for TENS electrodes are applied to the skin, as you see in the picture on the right. Um, over the targeted muscle, we are using the electrodes. Um, the electrodes are attached to a tense machine which stimulates the muscle or nerve with electrical impulses. Usually, atrophic re-innervated muscles are treated with low frequency TENS. It's typically to use 2 to 4 Hz frequency TENS to encourage the muscle growth and healing. Current intensity should be adjusted to provide muscle activation while still being comfortable for the patient. As the patient's tolerance increases, the intensity can be gradually increased. For atrophic re-innervated muscles, a longer pulse with white is often employed to encourage muscle activation and development. Common pulse duration from 100 to 200 microseconds. But we mostly prefer in re-innervation phase mostly long duration and short small frequency is the most preferred parameters for TANS. And radiation electrical stimulation, one of other of electrical stimulation that used in re-innervation phase. Radiation is used in re-innervation phase, but we should use radiation carefully, because if we use too many contraction in the muscle it may cause problems in the re-innervation phase. So we should be careful while using rational electrical stimulation. Rational electrical stimulation can be used in conjunction with muscle re-innervation techniques to hasten the process of nerve fiber re-innervation and muscle fiber activation. Rational electrical stimulation is a form of lumens that stimulates motor neurons and causes muscular contractions, provides muscular contractions by using high-frequency electrical impulses. Rational electrical stimulation can be used in conjunction with muscle re-innervation techniques to hasten the process of nerve fiber re-innervation and fiber activation. The purpose of the usage of rational electrical stimulation is to re-innervate atrophic muscles, activate them, promote muscular development, and increase blood flow. By causing muscle contraction, electrical impulses from the rational electrical stimulation can improve muscle function and strength and boost the synthesis of growth factors to aid in muscle development and repair. Increased blood flow to the major muscles can also hasten their recovery and improve their functionality. Electrodes are applied to the skin above the targeted muscle as part of the rational electrical stimulation procedures for re-innervating atrophic muscles. The rational electrical stimulation current is a medium frequency current with a frequency of 2500 Hz. This current is delivered in bursts with pulse length of 0.2 milliseconds and is broken up by pulses of 10 milliseconds. This produces 50 bursts of low frequency Faraday current every second. Frequency for rational electrical stimulation is mostly 25 Hz that is applied. In atrophic re-innervated muscle, this frequency is beneficial in stimulating muscle development and healing. Current intensity, while still causing muscle activation, the intensity of rational electrical stimulation should be set at a level that is comfortable for the patient. Pulse duration often use a longer pulse length to encourage muscle activation and development. Common pulse duration range from 200 to 400 microseconds. In the acute phase of the post-surgical process, rational electrical stimulation is not recommended. Another electrical stimulation method is modified galvanic stimulation. Direct current is used in modified galvanic stimulation to excite muscles and nerves to stop muscle wasting and enhance muscular function in the context of atrophy. Galvanic stimulation may be applied. The purpose of usage. Muscle activation. Atrophic muscles that have been reinnervated can be activated with modified galvanic stimulation. Modified galvanic stimulation should be stopped as soon as the muscle starts to contract voluntarily. Muscle growth. Modified galvanic stimulation is effective in promoting muscle growth in atrophic reinnervated muscles. Pain relief. Atrophic reinnervated muscles can also benefit from modified galvanic stimulation for pain elevation. The galvanic stimulators' electrical current can lessen pain by decreasing swelling and enhancing blood flow to the injured region. The recommended parameters of modified galvanic stimulation. Electrodes are placed on the targeted muscle's skin, um, and the frequency, as you know, the modified galvanic stimulation frequency is zero. Current intensity of the modified galvanic stimulation should be adjusted to the patient's comfort level while still providing muscle to contract. The current intensity should provide muscle contraction, but it shouldn't cause pain. As the patient's tolerance increases, the intensity can be gradually increased. Pulse duration for modified galvanic stimulation can be between 30 and 150 milliseconds to encourage muscular activation and growth. Longer pulse duration may be used. Other electrical stimulation method, low frequency current electrical stimulation. The aim of using low frequency current electrical stimulation to stimulate the muscle individually or in groups for diagnostic or therapeutic purposes. It's accepted that the most suitable current type for this purpose is quadrangular currents with a frequency up to about 100 Hz. In the treatment, generally between 1 and 100 Hz are used. The purpose of the usage, accelerating axon growth. A brief low-frequency electrical stimulation has been shown to accelerate axon growth across injury sites and enhance neural regeneration and target regeneration in animal models and patients. This is due to the elevation of neuronal cyclic adenosine monophosphate and increased expression of neurotrophic factors and other growth-associated genes, including cytoskeletal proteins. Furthermore, electrical stimulation of denervated muscle accelerates muscle innervation immediately after nerve transection and surgical repair also. In Gordon et al. Study, they conducted a randomized control trial to investigate the effect of low frequency electrical stimulation on axonal regeneration in patients with median nerve compression because of carpal tunnel syndrome. Patients underwent carpal tunnel release surgery, and those in the stimulation group received 1 hour of 20 Hz bipolar electrical stimulation immediately after surgery. They suggested that low frequency electrical stimulation can accelerate axonal regeneration and target reinnervation in humans. And in another study was conducted by Vivo et al. They showed electrical stimulation providing neuroprotective effect on sensory neurons, and they concluded that electrical stimulation had higher levels of reinnervation and a significantly higher number of regenerated myelinated fibers in the distal tibial nerve compared to the control group. The recommended parameters for low frequency current electrical stimulation, the electrodes should be placed on targeted muscles, skin, and the frequency mostly used between 10 and 30 Hz. but the mostly recommended parameter is 20 Hz. The current intensity is it should be applied to the patient's comfort level while still providing muscle contraction. As the patient tolerance increases, the intensity can be gradually increased. Reasons for use of electrical stimulation in reinnervated muscles. We have many reasons. One of them, electrical stimulation restores muscle function. Muscle that have atrophy can be stimulated with electrical stimulation techniques such as NIMES and FES, increasing muscular contractions and enhancing muscle function. When voluntary muscle activation is compromised, such as in patients with spinal cord injuries or nerve loss, these techniques can be especially helpful. Another reason for using electrical stimulation in reinnervation, electrical stimulation prevents further muscle wasting. By supplying consistent electrical stimulation that helps to maintain muscular mass and the strength, electrical stimulation can help stop further muscle wasting in atrophied and reinnervated muscles. Another reason, electrical stimulation provides pain management. In atrophied, reinnervated muscles, electrical stimulation techniques like TENS and modified galvanic stimulation can be used to relieve pain. These treatments relieve pain and suffering by activating the nerves that provide pain signals. Another reason, electrical stimulation improves muscle endurance. Muscle endurance can be increased in atrophied, reinnervated muscles using electrical stimulation techniques such as NIMAS and RES. These techniques can assist in boosting the number of muscle fibers that are activated by routine electrical stimulation, which will eventually improve endurance. Electrical stimulation enhances physiotherapy and rehabilitation outcomes. To improve results in the rehabilitation of atrophied reinnervated muscles, electrical stimulation approach can be employed in conjunction with other rehabilitation procedures, including exercise and physiotherapy. Electrical stimulation increases brain-derived neurotrophic factors. Neurotrophins, in particular BDNF, have been identified as key regulator of axon regeneration. According to the studies, short electrical stimulation promotes the expression of BDNF in motor neurons that are renewing. Electrical stimulation reduces muscle atrophy. Wieland et al. Used electrical stimulation for 5 days a week for 1 hour for 1 month with electrodes implanted in the gastrocnemius muscle immediately after tibial nerve transection and immediate repair with the fibular nerve. 2 months after repair, it was discovered that stimulated animals had significantly higher muscle weights, which strength and type 1 fibers than repaired controls with no stimulations. Electrical stimulation speeds up muscle reinnervation. Garden et al. Evaluated whether electrical stimulation promotes axon regeneration and muscle reinnervation in carpal tunnel syndrome patients, and they found that electrical stimulation provides reinnervation in carpal tunnel syndrome. And in conclusion, we know that rehabilitation of atrophied reinnervated muscles has shown promises by using electrical stimulation techniques. Biphasic modulated and low frequency stimulation, such as 20 Hz, has been found to be the most successful frequency in restoring muscular function, stopping additional muscle wasting, and improving the results of physiotherapy and rehabilitation. So in the reinnervated muscles, we will use 20 Hz frequency. One of the goals of future studies in this area may be to apply electrical stimulation approach to cure various form of muscular atrophy, including age-related and disuse atrophy. Electrical stimulation methods have the potential to play a significant role in the rehabilitation of atrophied reinnervated muscles, thereby improving patient outcomes and quality of life. So in reinnervation phase, we may use electrical stimulation, and the studies show us that electrical stimulation has many positive effects on the reinnervation phase. So we should use in the reinnervation phase electrical stimulation. Correct. And these are our references, and these are our project partners from all of the universities. And thank you for your listening my presentation and for your participation. And thank you all.